Hi there, a warm welcome to all of you. And today is 23rd of July, Saturday, and hope you're all doing great. Unfortunately, the situation around us is not that great, and the fact is that a lot of us are turning COVID positive. Your friends, people around you, family members, no matter which part of the world you are, you must be noticing there has been a surge in infections, and that is something which is a matter of that's something it's really a matter of concern for most of us, and it's a matter to really ponder. It's a matter of concern to think about that, despite having billions of doses of vaccinations, despite the fact that most of us have been vaccinated, have been infected already with earlier variants of SARS-CoV-2, why are the cases rising in our society around us and also in other countries of the world? In COVID, we are all interconnected. That's something we all must remember. So talk about the rise in cases. If we talk about the root cause behind the rise in cases, as far as we all know that the third wave or the latest wave of COVID-19 that came a few months back was because of the newest variant of concern of SARS-CoV-2, and that was the Omicron variant. So it was the first Omicron variant. Then there were several sub-variants of Omicron. First it was BA1, then there was BA2, and BA2 was known as the stealth variant of Omicron because apart from its ability of being increasingly transmissible, it had also an ability to evade vaccine-induced. It had an ability, apart from its ability to evade immunity, it had a notoriety for being not getting regularly detected on the testing kits. So apart from that, the thing that really matters now is to understand what are the sub-variants of Omicron that are driving this surge. If we talk about the number of cases yesterday, that is on 22nd of July in India, then we have had 21,880 cases and more than 60 deaths in last 24 hours. The cases in the society actually may be much higher because not many people are getting themselves tested. Many of them are fortunate because the symptoms are passing off with minor flu-like symptoms. Sometimes the symptoms are not that minor, but people have had a certain degree of fatigue and they are no longer getting themselves tested. So the actual number of cases be much higher. And the same is the state of affairs with the United States and several parts in Europe as well. So what is the sub-variant of Omicron that is driving this surge? Let's try and dissect these facts over here. Before we talk about India, let's focus on the sub-variants that are driving a surge in United States. In United States, BA4 and BA5 variants are driving this surge, and some commentators are equating these variants to actually what you can call as Delta Cron, because apart from having the incredibly infectious ability of Omicron, these variants are also having certain degree of virulence, which is not even though it's not that bad as Delta, but certainly more virulent than or more pathogenic than the pathogenicity normally we associated with the Omicron variant. So, and talking about India, BA2.75 or BA2.75 is the variant that is predominant, is the sub-variant that is predominantly causing the latest surge in infections, along with some other sub-variants such as BA2.74, BA2.76, and in some parts of Eastern India, as identified by the ILS or Institute of Life Sciences here, it is BA2.38. Talking about these variants, interestingly, BA2.75 has been termed as Centurion by some Twitter user, and I don't know why and how they have coined this name. It's interesting that Centauros is the name they have. It's the name of a Greek animal. It's half human and half horse, but that's out of the context here. and the experts are not happy with this name. So Centaurus 2.75, that's out interesting. So to talk about these three latest variants, these variants have got certain mutations that can evade immunity existing in the body. To talk about the ability of any new variant to establish an infection in human body, we must understand that the variant, the subvariant or the variant should have an ability to overcome the immunity that is existing within our body, whether it's vaccine induced immunity or whether it's infection induced immunity, or an immunity arising out of both vaccine as well as infection, that is known as a hybrid form of immunity. Now our body has antibodies against the spike protein. What happens when the spike protein goes mutations and the antigens against which our body has antibody, the antigens themselves change? So obviously those antibodies will no longer be effective against those the antibodies in our body will no longer be effective against those antigens. So that is the situation where the subvariant of Omicron would be able to establish an infection in a human being, because the pre-existing antibody is no longer able to protect against that newest subvariant with a newest set of infection, with a newest set of mutations within it. These three subvariants, as I was talking about, BA2.75, 74 and 76, they have got more than 9 mutations in their spike protein. So whether it's United States, whether it's India or any other part of the world, the bottom line is that COVID is far from over, and we better brace ourselves for newer and newer waves of infection. It doesn't have to be that bad that it has been earlier, but certainly every individual who has a new infection, despite having infections in the past, despite having vaccines, despite having booster doses of vaccines, it's not easy for him, it's not easy for his family members. So don't forget that COVID is not just flu, it's still time that COVID may one day turn as benign or as innocuous as normal flu, but the time hasn't come yet. So we cannot let our guards down, and it may not be possible to advise everyone or for governments to implement those things that we have been through, lockdowns and all. Those are impractical things, but something that we can do, that that's basically at an individual level, that get your vaccines taken, take your booster doses, because the government in India has made booster doses free. Vaccines have been made available for children as well. That has been there for quite some time, and so far as India is concerned, there is one amidst all these dark clouds, there is a silver lining. Our country has completed 2 billion, on that is 200 crore cumulative doses of vaccinations. So that's not a small feat, that's a remarkable feat, and the fact that India has done it with its indigenous vaccines is a humongous achievement, and congratulations to the people of India, congratulations to all of us, congratulations to the government of India, whether it's the national level or the state level, and the millions of healthcare workers all over the nation who have put in their hard work and the scientists who have been the think tank, the scientists, the brains that who have been behind this remarkable achievement. So with that note, I would like to conclude my talk here, but with a note of caution that let's mask ourselves. Let's remember that it's not over until it's all over. So, and no one is safe until everyone is safe. So with that note, I conclude my talk here, but remember, you must mask yourselves and take care of yourselves, stay safe and stay masked. Thank you.